This young man presented with head jerks, twisting of the neck to the left and the right, bilateral wrist tremors, bilateral arm jerks, bilateral leg jerks, vocal tics, constantly saying, "No, no, no." This boy's TMJ symptoms were bilateral frontal, temporal, and occipital headaches 2 to 3 times per week for the past 5 years. Bilateral mastoid pain for 5 years. Photophobia, bilateral retroorbital pain, vertigo and lightheadedness, loss of equilibrium, bilateral tinnitus, bilateral TMJ clicking upon opening of the mouth, bilateral TMJ clicking upon protrusion of the mandible, bilateral TMJ crepitus, bilateral suboccipital pain, bilateral neck pain, stiff necks in the morning, cervical crepitus, bilateral shoulder pain. This is this young man's panoramic x-ray. Notice the impaction of his wisdom teeth. It is always best to get these teeth taken out prior to the institution of treatment so that the discs are not dislocated after you started treatment or the case is made more difficult by this surgery. Get all surgery done prior to delivering the appliance. If the patient needs other types of surgery like gallbladder surgery, colon surgery, female type surgery, get all of that done prior to instituting the treatment and reevaluate the patient after they've had their general anesthetic for these surgeries, because frequently the intubation process will adversely affect the temporomandibular joint. This is this young man's cephalometric x-ray. Notice the good drape of his soft tissues of his profile. The lower lip is not horizontal, it is vertical. The upper lip drops vertically too. He also has an excellent airway going for himself, which is good. Many of these patients will have a very narrow airway. This is another view of this patient's airway. Look how excellent and wide this is. Also note he's got compression of his suboccipital tissues. You're supposed to have a 14 millimeter space between the base of the skull and the top of C1. And C1 is supposed to be at a 45-degree angle like this. And as you can see, it is horizontal. This is a young 23-year-old male with all kinds of facial and neck tics. He's in a very unusual case. Instead of these tics beginning at the age of 6.5 or 7 like most of them do, these began just recently at the age of 22. So he's had them for the past year. He's got 4 different types of diagnoses. Tell them what you have.
They have diagnosed me with 4 different types of dystonia, cervical dystonia, myoclonus dystonia, generalized dystonia, and dystonic tremors, rapid onset.
Okay. They started with his left leg a year ago. We gave him a bunch of tongue blades to play with last night, and he returns and says that he was able to go to sleep after about an hour instead of the usual 3 or 4 hours it takes him to get to sleep last night, with 8 tongue blades in his mouth. And he likes a vertical dimension of between 8 and 11 tongue blades. And so we're having the appliance made at a laboratory today and overnight, and we'll deliver it tomorrow morning and show you. It will be at least 8 tongue blades high and as high up as 11. And that will be our starting point. This young man returns the next day and told me that approximately 9 tongue blades diminished his head shaking somewhat and allowed him to fall asleep in 1 hour instead of the usual 3 or 4 hours it took him to go to sleep every night. And this translates into about an opening of 16 millimeters interincisally. And so what we did today was make him his lower appliance, add the acrylic onto it, and have him close down. Like, and you can see how this is approximately slightly less than that. I'll tell you what, take that out, I'm going to make it taller.
Last night, whenever I laid down, I fell asleep within probably 5 minutes of laying down, whereas before it would take 3 to 4, maybe even 5 hours to go to sleep. I would stay up till 4 or 5 o'clock in the morning before I was able to fall asleep, but with this new mouthpiece, I was able to fall asleep within probably 5 minutes with no sleep aids, as the doctors were trying to prescribe me before I came to see Dr. Stack. And now I have no problem going to sleep, and I don't have to take the sleep meds that they were trying to get me to take before.
This young man returns in less than 24 hours wearing the appliance. I want to show you how thick we've made it. He is occluding on the appliance now. It is 15 millimeters tall. Don't be afraid to go into an open bite situation by making a tall appliance like this. Now, this young man is going to tell you what he's experienced over the past 24 hours or less.
I got my mouthpiece from Dr. Stack yesterday afternoon. Before seeing Dr. Stack, I was not able to walk up a flight of stairs without having to either take a break or climb on my hands and knees the rest of the way up. And yesterday I was able to get out of the car, and I probably walked about 3 miles, seeing all of the national sites in Washington, D.C., and I even walked up the Lincoln Memorial with hardly any problem. I had to just stop one time to get a break, and before I would have only made it maybe 3 or 4 steps, and that would have been it. It feels almost like my life's been given back to me. I can't thank Dr. Stack enough already for the changes that I felt, and I know it's just going to get better as time goes on.
Okay, you can become a rich man and remember me in your will.
Yes, sir.
Just teasing. Okay, we're going to let this young boy go. He's 23 years old. He's married. Do you have any kids?
No kids.
No kids. Okay, he's going to go back to his young wife now, and we're going to see him in 6 weeks or so for the first checkup. This patient returned 6 weeks later for his first checkup. He told me he had 5 very, very good weeks in which he was approximately 90% better. And then his tics started to return in the last week. I rebuilt his appliance up, the 1.5 or 2 millimeters it was worn down, and sent him back home. He told me for the first time that he was taking 23 medications per day, and that over the 6 weeks he had reduced it down to 6, only taking 6 pills per day now, and he considers that a massive improvement. I'll consider it a great improvement when he's taking no pills per day.